Today, I'm joined by Judith and Kristen from the Albuquerque Area Indian Health Board. Welcome and thank you both for joining Caspio's podcast. So to start us off, could you please introduce yourself and share a little bit about your background?
Yes, my name is Judith Espinoza. I'm an epidemiologist here at the Albuquerque Area Indian Health Board, which houses the Albuquerque Area Southwest Epidemiology Center. We call it Aztec, and I've been here for about 15 years.
Kristen?
My name is Kristen Tsosie, and I've been with the Albuquerque Area Indian Health Board for the past 9 years. In the last 5 years, I worked as a database administrator, where I support a wide range of projects that help improve the health outcomes of our Native American communities. And so far, I have about 6 years of experience in computer information systems through formal education and self-teaching. And a lot I've learned through Caspio in the past 5 years. So it's been a great learning experience through Caspio.
Great. Well, thank you both of you for joining. And for those listeners that are not familiar with your organization, can you provide a quick overview of what the company does and your mission behind your work?
Okay, so Aztec is a tribal epidemiology center, and we're a nonprofit. So all of our money is soft money, and we support the health of tribes within our area of the Indian Health Service. And that's 27 tribes that we serve. And we really support them in an infrastructure way of providing them databases, being able to collect information. And one of the things that we do that I think is so important is that we really support data sovereignty for our tribal organizations, simply because if they can't collect it themselves, they can't produce anything from it, and it's harder for them. But it's really satisfying throughout the years to be able to produce these databases for them, particularly for programs. They use it for grant reports, program evaluation, as well as program planning. And when you see that cultivation from paper to Excel to an online database, it's really satisfying.
It's I was having a chat with you both before, and I think it's amazing what your organization does. And I was reading that you've recently celebrated your 45th years of service, which is outstanding. So can you please explain a little bit about the communities you serve, and what does that milestone mean to you guys?
Kristen, do you want to go ahead and kind of speak?
So we do serve the communities of the Southwest, mainly in the Albuquerque area. And AAIHB has been around since 1977. We're always focused on improving the health and well-being of the Native American communities. This includes, like Judy specified, includes public health programs, disease prevention, health education, and it's care that respects traditional healing practices and community values. The tribes and organizations can make informed decisions and to advocate for the resources they need. So in the Albuquerque area, we have, I'm not too sure how many Pueblo communities and tribal communities, but we also do focus in Texas and Colorado as well. Was there any others that I did not include, Judy?
There's a little bit of the Ute tribe in Utah.
Right.
So it's a vast area that we cover. And not completely, just different pockets.
Okay, thanks for sharing that. So you've been a Caspio customer now for over 10 years, I think it is, looking at the dates. So can you take us back to the beginning? What challenges was the organization looking to solve at the time?
Yeah, this is before Kristen's time, but we had already started creating databases at their request, and we did it in Access because we figured everybody pretty much had access, but there was a few people who used Adele. But what we found was that the communities did not have the infrastructure to put it on a server. Every computer might be a different level of Windows, a different level of access. It was really tough. We also, in order to maintain privacy, we would have to either go out to the communities and get a flash drive and then bring it back to do data analysis, or we would have to go out there and make those changes. And then sometimes in the end, you'd realize you made one change, and then you go to the next office and you try to make that change, only to find out that the key problem was they weren't either talking to each other or they were different programs. And this one is so much easier simply because it's online. We know it's HIPAA protected, which is what we want. And we can do all of this stuff remotely. We can go out to the communities if we need to, but we can make a lot of the changes if it's just simply, please change this wording. We would prefer it be this way or that way for us. We can do that without actually having to go anywhere, and it changes it for everyone or just for that selected community. And that has just made it so that I don't even remember how many different modules we've had, but it just made it so much where we can do a lot more. So we went from really helping out with diabetes programs to community health workers. Let's see, we have social services, we have a rabies, for rabies is for vaccinations, because many people leave their leave dogs around in open areas in New Mexico, and so they have a nice vaccination program for the people who live in their community, just to make that clarification. But we have all kinds of different types of modules that we have created for these different programs that otherwise I'm not sure how they would be collecting their data if they weren't using the system. And what's so nice is because we are an epidemiology center, there, once a year, I have certain people who just email me or submit a ticket, because we use a ticket system that Ned provided on one of his Caspio live sessions, which we really enjoy. And they just submit that. And once a year, I produce a customized report for them to meet their needs. And if I can't do it, then I ask another epidemiologist to do it. And it's all without having to travel, all these miles to get that to them, and we can do it securely.
Yeah. It's I know both of you don't have technical backgrounds. You've got different backgrounds as well. How was your learning curve? You mentioned Ned and the videos and the live streams and things. So how was the journey of learning Caspio and low code?
Well, 10 years ago, we didn't have as many resources, but it was actually, once we learned the system, it wasn't too difficult because we knew how to use Access. And it was pretty simple. When we had a problem, there's the asking for help. We have contracted with Caspio before when we had a big project and there wasn't anybody to be able to help us, and we learned a lot just by asking for help, and then they're showing us what we did. And I would say, though, we usually, if we have a new person come on, we kind of give everybody about 6 months. And if they just do that for 6 months, I think they can feel really comfortable doing certain things. But you have to realize now we have 6 months and we have like 500 people that are our end users. We have a lot. And what would we say are the number of tickets we have a month? Kristen, 20, 25?
A month?
Yeah.
Yeah, we have about 20 to 30 a month coming in constantly now. So it's been a constant stream for us. It's like almost a ticket a day.
Right. And so we're doing a lot, and it's just, so it's about in 6 months, we feel like that person is really on and can contribute and start doing the work. And that's with not as on a whole lot of level. I think that was what took Kristen about 6 months, and we were very busy at the time when Kristen started.
Yeah.
So.
Yeah, I see, Judith, that you've become a Caspio certified developer. So having zero background in this area to become completely certified, which is great to see. And hopefully that helps you as you're going through your journey.
Oh, yeah. Well, that's a really nice feature, too, because we feel more confident now that we've reached that certain level of work. And but really, we a lot of it is down to the fact that there's so much help that when I get stuck, I usually say, don't work more than an hour trying to figure something out. ask for help after
Yes.
that because it's there.
Yeah.
There's no reason to spend a lot of time on something that you don't know, whether it's one of us can help each other or, just there's a ticket system or we can ask for it. So it's really nice.
Yeah, we've got a 24/7 support team here to support and help you with any issues that you might have. So, yeah, always there to support you. So let's kind of shift gears a bit in terms of what does your application do and who are the end users?
Ooh, our applications do an awful lot. So for some programs, they want to track on an individual level.
Yeah.
Let's say how many times somebody goes into the gym to work out because we're talking about health and promotion, or tracking, what services are being gathered. So it can be on an individual level, it can be a group level. It's always geared towards what they're currently doing. So we don't have to come in. That's what we really like is so many times we've helped out people and they said, oh, this was going to cost us $10,000 and they were going to build it this way. And then you're stuck with how they set it up and you can't make changes. And we just go in and say, okay, so how is your business? What are you doing? How is the flow? And then we create it for them.
Yeah.
And I think it works out really well. I mean, every once in a while we have one that doesn't quite get used the way we would like it to. But I think that was more in the beginning, and now it just seems we do it internally as well as our external partners. So
Yeah.
many of the tribes can do it, but yet we also do it internally. So we have an audiology department, and we're doing one so they can track patients and their orders and hearing aids, as well as our staff, then what equipment they have, putting in orders for what is it? What are the orders for? And since this is yours,
I also wanted to include a big one that Judy is very modest about, but we had a COVID-19 tracking system, which was a huge program that helped the community and also the state of New Mexico, because I believe we work in partners with New Mexico Department of Health as well. And so it was a tool that helped communities monitor cases, vaccinations, and reporting during the height of the pandemic. But that one I always remember as the golden application.
Yeah. So what we did was we had to track anybody who was in quarantine received a daily call.
Right.
And so we tracked every phone call. We made assignments. But I did have an incident during that time that I always think is so thankful for Caspio. So we had been working long hours. I don't know how many days I had worked in a row, and it was late at night. And I hit the delete button on the table for all of our cases on a Friday evening and just about had a heart attack, just dropped to the ground. It's like, oh my, no, I didn't do that. Did I really? And so I called to support, and in less than an hour, it was back up and running.
Yeah.
And we didn't lose any data or anything like that. But it was just, so I just kind of it was so intense time. But yes, it did help us track. And we still provide those back. It was only 7 communities out of the 27 that asked for our help, because some of them were hit harder than others. But we provided reports, and everybody was working on that team.
Yeah.
But I did learn that if something gets deleted, it's pretty easy to get it back. But I don't recommend doing it. I mean,
not on a Friday evening as well.
Strong,
right?
Yeah, you have to have a strong heart because it was shocking, but I was very pleased, and it didn't really cost what you would think. It wasn't like, oh my gosh, it was reasonable, so and very helpful.
So how would you say your applications evolved over the, I suppose, last 10 years, really? I suppose it has.
Kristen, do you want to talk about that?
Well, I feel like we've built quite a variety of applications. Internally, we've also started a digital transformation for document management to ticketing systems and, handling support across multiple applications. So like Judy mentioned, we have an educational materials ordering system for health educators. We have data portals for tribal court, social services, wellness programs, and like she said, rabies tracking systems, gym and health activity tracking. We also work with schools that we supply student surveys for student sports and inventory tracking. So the list goes on and on related to health data. And so the end users range from tribal staff to community health workers and educators to program managers and data teams. But I think the goal always has been to provide tools that are customizable and user-friendly. And so that's always our aim, and our intention is just to always help the end user and make these programs work for them so they can get what they need to serve their communities effectively. But I feel like we've learned a lot going down the Caspio road. We've learned techniques where it cuts down time for us. Like sometimes it would take us multiple tutorials to figure out, one simple thing. And then once we learn that task, it's kind of like embedded in our heads, and we have to remind each other, through our notes or just through our meetings, like, hey, here's a tutorial, or here's something that I learned. And we really just try to keep on track with a lot of that. But with technology changing all the time, it kind of goes fast for us. So it's an ever-changing field for us. But so far, we've enjoyed it for the most part.
Yeah, I think the newer ones were a little bit, I think they had to do a lot more clicking on the older ones. And then now we're just sort of like a community wanted to do a survey, and we set it up so that each page only had so many questions, and then they could go to the next or they could go back. And we had a progression bar for them. All these things that we've sort of learned through watching the videos and tutorials, but we're ever so conscious of how many clicks does somebody have to do to get what they need.
Yeah.
And that has, I think, really reduced that tremendously. And they look cleaner, and some of them might look nice, but I think they act better. And I remember at the very beginning, we put a graph on one of our pages, and it slowed it down so much that, and of course, this is 10 years ago, and it slowed it down so much that you couldn't really see anything there. It was like, it was almost back to dial-up time,
Yeah.
And now we have data dashboards that are almost instantaneous, and we don't get that complaint anymore.
Yeah.
So that's how things have changed. And even problem solving has changed. I know I personally haven't done it, but Kristen is basically sort of my troubleshooter. She's my go-to person when I'm having an issue, and she just uses the AI to find solutions or different things. And I just call her my miracle worker, because I just kind of go, okay, here's the issue, and she goes and finds it, which is really nice.
It sounds like you two have become experts now, from what I'm hearing, with all these applications and how you put yourself in the customer's shoes. I think that's really interesting. You're talking about the number of clicks to get what you need. It's all about the experience. So I can imagine your newer apps are much better than your older apps in terms of customer experience.
For sure.
Yeah.
So, Judy, you mentioned HIPAA before, and I know this with a lot of other customers, compliance is really critical. So why is it so important for your work?
Well, so many of the things that we do is to be protected. So not only when you work with tribal entities are you wanting to protect PHI, which is, the patient health information, but we want to protect it on a tribal level as well. Because there's so many times in the past that our tribes have been exploited because somebody gets a hold of data. And by using the HIPAA version, we have two accounts with Caspio. One is non-HIPAA, which we use for registration and things that we don't need to, our ticket system, right, where there isn't any
Yeah.
PHI in that. And then we use this other system and we use the PHI because we want to make sure that our tribes know that we are using something that is at a high level of security. Their information is secure. Yes, they can use any device that has internet, their phone, a tablet, a table, a laptop, or your basic desktop. And it doesn't make any difference if it's, a Dell or a Microsoft or it's, something that they put together. Whatever your operating system is, it makes it so much easier. But everybody's always so concerned about, well, how I don't want this person to know or who didn't have that person. And so we have data sharing agreements with everybody, but we work with the person who asked the question
Yeah.
and say, who do you want to see what? We also had a wellness court where the court got to see certain things like notes that the behavioral health staff had, like, yes, they went to their voluntary services, they went to counseling, they went to the group counseling. They got to see that, but they didn't get to see the notes. And so we make sure that everything is partitioned so that if you don't have the permission to see it, you don't get to see it, even within tribal communities, because we really want to make sure that whoever's using our system feels confident that only the proper people are going to. Now, we ask that they don't share their passwords. Only one person is allowed in at a time. But if they do that, then only the certain people are going to have that. And what's really nice too is I remember one of the biggest problems that I encountered really early on is somebody said, well, so and so left, they deleted the computer, they got hired back again, and they said, oh, can we have your database? And I said, that was on your computer. I don't have that. Did you make a copy? No, and that can't happen here. And we can save the old modules and we can save data, and we respect any tribe that wants their data back. But it doesn't go away just because there's a change in staff. And that's really, it's very, very helpful. I've had some communities where we have, we do 10 years of worth of reports, so they can do trends and see where they need improvement and what happened. And of course, everybody has the blip during COVID, but it's very helpful to be able to see that and who's coming and whose services and what's going on. So we're expanding. We've had a few more calls so that we want to be great data stewards and setting up sort of that data portal we talked about and putting things in. And, I feel like that's coming along, but a lot of it is trust.
Yeah.
And I feel like we wouldn't have that trust if I couldn't talk about how it's HIPAA compliant, how it's encrypted three different ways and 3 different times. And so otherwise they wouldn't do it. Why would they trust us with data that might be able to get out? And I feel like this is really helpful for us.
Yeah, makes complete sense. So you mentioned the end users, Judith, earlier a little bit about how do you incorporate feedback from the end users into maybe your new apps or when you're enhancing your apps?
Well, we do. I mean, I recently had one of my communities, they just said, you know what, we had a turnover in staff, and originally they wanted to track all of these things, and then suddenly they said, nope, the new staff doesn't know how, it's just too much. And so they didn't realize it, but the tables didn't change. It's just their page changed, and it was, like I said, fewer clicks. And it was exactly what they wanted to collect, not anything extra, just what they wanted to collect. And we listened to them, and when we were able to actually do it in about 3 months, and they didn't lose any of the data because they didn't, because like I said, the tables were changed, and they didn't have to know any of that. all they wanted to know was, oh, this looked like a brand new database. And it really wasn't, but we just listened to what they had to say. And the ticket system that Kristen has put together is just so helpful because she has it come. We have a Slack channel just for our little group, and it comes in through Slack. It comes in through our emails, and then we immediately in Slack say, who's going to take this ticket, so we're not both working on the same thing, and then we keep track of them. And it's so nice, so that we can meet with them if we need to, so that they get that good experience of what is it that's the problem? Why aren't your people using it? Is it just too much?
Yeah.
We had one group that I'm working with. Well, Kristen's actually helped me now, where it's a group of coaches and they're working with Native American youth, and it's just taking attendance. And I set it up so they could just open up their phone, click to see if check the box if they were there that day, and then hit submit and they're done. And coaches don't really want to do that. They don't want to keep a clipboard of who's present either. And so this is just a nice simple way for them to be able to track that. And knowing that it's going to be their phone, it's really quite easy to make sure it looks appropriately. The only thing is, I have to have them rotate their phone long ways in order for it to show up so they can do it. But other than that, it's, that's the experience that they want.
Yeah.
Yeah.
So reflecting on kind of your 10-year journey with Caspio, what would some of the biggest lessons be that you've learned over this time?
Okay. That there is a limit, and it's there. There is a limit to how many variables you want to put into a table. Because I had this big collection and it was thousands of things they wanted to put in there. But I learned that, you really just make it into separate tables and the views put it all together for you later. And that was helpful. And I think too, there were things that we had difficulty at the very, very beginning, like how to avoid duplications and this kind of thing. And now it's sort of like it's ingrained in us. It's
Yeah.
sort of like, okay, you make first name, last name, date of birth unique. Okay, with tribal and identity, and then it's unique, and we have that. We're in the very beginning. It was really hard for us to not have that duplication, but that doesn't mean the name needs to be spelled correctly and stuff like that. There are some things we don't allow our end users to do, such as deleting people, because once you delete them,
Yeah.
and we change records for them. But that's something that they're okay about us sending a ticket to, because that way they're not losing information. We have one community that has, oh my gosh, what is it? 10,000 people in the database. And then we might have another one that's, if they're lucky if they have like 200.
Yeah.
And so they have this wide variety of who's coming in and who's using it, or who's they're tracking their individuals on and trying to get duplicates and things like that to occur. It's just a lot easier now. And we put in things like aliases or nicknames, because there's a lot of nicknames. And I think that's the things that we've learned. Anything you want to add?
I guess I think a lot of the times as well is like when we start any of these projects is just like really understanding like specific problems we want to solve. So like, if we are with a client, like we want them to understand, this is what you want out of this database portal. This is what you're looking for. And so sometimes a lot of they get maybe a little too big-headed about what the program can do, or they get fixated on the colors and font, and we really want to bring it back to like, what data are you trying to get out of this program? And so a lot of the times it's it's just working with the client and making sure that we both understand, the specific problems that we're trying to solve within it. But Caspio really helps us out in customizing, anything. They're always asking us, can you do this? Can you do that? And we're like, yeah, I think we can do that. And so it's always by trial and error sometimes. Yeah. And it takes us maybe a week or a month to like really figure out if something can like legit work, and, the program works perfectly and everybody's excited about it. And also it's like, you want the client to use it right away, but like you want to see the data inside the program. You want to see the reports reflecting, everything correctly. And so sometimes it takes a while for those clients to get it going and really working the program. But that's my, I guess, big thing that I've learned is just to really understand from the get-go that what you're trying to solve.
Yeah.
I think another thing that we learned too is, and when Kristen started, we were doing screenshots for, how to use the database.
Yeah.
And now it's just, hey, it's either a one pager kind of thing. Go here, go here, go here. And more than often we just say, watch the video. And we are, in their instruction videos. And so we try to make them 5 minutes or less.
Yeah.
And usually when people watch the videos, it's like, yeah, that's it. That's what we want. And we do them, little pieces by little pieces. And that's so it's easier to do a video now than it is to take screenshots.
Yeah.
And try to keep up with it. Because like sometimes people get hung up. Wait a minute, how come this has changed? It's like, oh yeah. Yeah, we changed that a year ago and we didn't change the procedure manual. So we've learned that that's easier and faster and makes our job a little bit nicer. And we've learned to put that on the site, build it in. And
you mentioned you've got several applications. Which one do you think's been the most significant in terms of impact on operations or efficiency or the community programs?
Well, the one for COVID, I think, was the biggest one. We built that one in less than a month.
Wow.
And not really, it was very interesting because our state health department at the time didn't have the infrastructure to do what they asked us to do. And they gave us Excel spreadsheets. And so we just put it all together, got it done. And then as that expanded, like when things changed, such as we now had a vaccine. Okay, then we added that question, and it wasn't that hard to make those changes and how we built it on. But I think it was simply because we were all working remotely. We contracted with people to help us with that. And even our contractors who were doing the calls and the contact tracing and interviews and everything, they may not actually have been in New Mexico or Colorado, but they were all able to do it and do it accordingly and make those changes for those communities and give that community their information back. And we still have a few communities who still use it to track their cases. Now they just want to do it on their own. They just want to see, are they seeing an influx or not? And so their community health workers do that. And it's really satisfying that even though it was a huge project to begin with, we were able to scale it back when we needed to and provide it for them. And then at any time they go into their dashboard and, that's what I love about those graphs is they just, hit download and it's, do you want it as a PNG? Here's how it's going to look. And they can put it into a report or a presentation to their tribal community or their, or a community meeting, and they don't have to ask us. And I love that.
Yeah. Well, thank you for sharing that, Judith. So kind of wrapping this up then for listeners from nonprofits or organizations considering low code and Caspio, what advice would you give them?
Well, one of the things that we picked Caspio was it is easy, and we haven't worked as much in the new Flex system as we have the bridge, because we've been doing that for a long time. But what's nice is it's just Kristen and I right now. We don't have to worry about the HIPAA. If we would have our budget would be so high trying to do the protection of HIPAA that it wouldn't be cost effective. But this makes it so we can provide that. We can provide this for our communities in a way that, we don't charge our communities for anything that we build. And so we're giving them something they wouldn't actually have. The most they have to do is get a grant either for hotspots or internet and tablets or whatever they're going to use it, but they don't have to worry about that HIPAA, which I feel like is so important. And I would say that's why we selected it. It's easier. It doesn't make any difference if you're doing a survey that other programs will provide for you, or if you're actually tracking patients or clients or whatever, or events. It's all in there and together. And it's really, really nice. And they have some absolutely wonderful features. Like I said, our Slack channel gets notified. There's emails. We also send out an automatic text to people that we call when we're trying to do a online survey. So it's so versatile that it's a nice place to go. Whereas, like I said, if you wanted to do this in-house, we would have to have lot more people monitoring, and I don't feel as vulnerable. I feel very comfortable and confident about it being HIPAA and high-tech protected, and not worrying about, I can just concentrate on what I need to do. This is why we're buying this service.
Yeah. Well, Judith and Kristen, thank you so much for your time today. Thank you for being a Caspio customer for the last 10 years and for sharing your low-code journey. I think listeners will find this very, very interesting. And here's to many more years of success.
Thank you.
Thank you.